Today I want to talk to you about chemotherapy and the effects that it can have on the person, and importantly, how exercise can really have a great impact on the severity of these symptoms. Now, obviously, chemotherapy is essential often for people going through cancer, so it's really important to understand the impact that exercise can have as a medicine for those who have received a diagnosis and are working through this form of treatment. The points that I want to discuss with you today are looking at fatigue, looking at neuropathy, bone loss or osteoporosis, and looking at heart health or heart problems. Now, the first point or symptom that is commonly reported for those going through chemotherapy, that is fatigue. Fatigue is the most commonly reported symptom for those who are going through treatment. Now, sometimes fatigue can feel really hard to explain and it can occur quite suddenly. It's important to remember that even a 5-minute dosage of exercise can be helpful. And I say dosage because I really believe that exercise can act as a medicine for people for many different types of symptoms. I really believe that exercise is medicine. Now, when we exercise, our body releases many hormones and it helps to regulate many neurotransmitters. And this has a really positive effect on boosting our energy levels and also our cognitive function and looking at mood regulation. So, two main hormones that our body releases or regulates are dopamine and serotonin. Now, serotonin and dopamine are both seen as pleasure hormones or happiness hormones, but they also have really important functions when looking at our mood, our memory, appetite, our GI motility, and also looking at our levels of function, so looking at our motor control and the way our nerves work. So all of these functions are really important for our overall level of energy. Without sleep or appetite, without neural control, our energy levels are going to be affected. So by exercising, we're overall increasing our energy levels when we are looking at that spike in dopamine and in serotonin. From there, we look at neuropathy. And neuropathy is simply damage to the nerves. And this is seen really commonly as chemotherapy-induced peripheral neuropathy, meaning that chemotherapy is inducing nerve damage to our peripherals, often through our hands and our feet. Now, exercise can play a role in short to medium term relief of symptoms such as pins and needles, numbness, and tingling. Exercise also helps to increase activation and muscular contraction through those areas to help reduce the risk or the likelihood of muscle atrophy or muscle wastage. So exercise can play a really important role on the symptoms and severity of neuropathy, which is really common for those going through chemotherapy. From there, we're looking at bone mineral loss or osteoporosis. Now, chemotherapy, steroidal medication, and hormonal therapy can all increase bone mineral density loss. So it can reduce bone strength, and this can have an impact on speeding up the risk of osteopenia or osteoporosis. And this is going to increase the likelihood of bone pain and also fracture, which has a whole other array of problems. So the way that exercise helps is that when we load bone, it signals our brain to actually place more bone mineral into that area and remove the older or the mature cells with more newer cells. And so this helps our bone, this is called the remodeling phase. It helps our bones to stay nice and strong over time. So we're constantly putting new minerals in, removing the old cells, and so on as we age. And this can't occur as well if we're sedentary and we're not placing enough load or weight on our bones. And when we're going through chemotherapy, this bone mineral loss can sometimes be sped up. So by exercising and regularly placing load through our joints, so doing resistance-based training, this can help to replace bone minerals that can be lost through chemotherapy, steroidal medication, or our hormonal therapy. So really important in that sense. And this can have positive effects as we age, where it gets to a point that osteoporosis is already a risk factor on its own. Lastly, I wanted to look at heart problems. Now, research has shown that when going through chemotherapy, we can have problems with blood pressure, weakening of the heart muscle, heart arrhythmias, so heart rhythm problems, and blood clotting. It's also indicative of any problems that you might have had before your diagnosis, so were there any pre-existing conditions to be aware of. So in this sense, it's important that your oncologist talks to a heart specialist and they work together. But looking specifically at exercise can help. We know that regular exercise, looking at aerobic exercise, cardiovascular exercise, it can help to strengthen the heart. Now, your heart muscle is just like any other muscle, just like your bicep or your quadriceps. They need muscular contractions and stimulus to get stronger and to maintain that reliability. So if we're not working our heart, the heart muscle weakens, and this is going to cause many problems. We also know that exercise can help with blood pressure, and it helps to maintain the strength of our arteries, which may help with any risk of clotting, and then on to our looking at strokes. So exercise and cardiovascular plays an important component of your overall health if there are issues around your heart during treatment. Now, the golden question, how much exercise should I be doing? This has so many factors to consider that we couldn't really give you an ideal sort of number. We need to be looking at the treatment that you're having, your exercise history, have you had any surgeries, what are your current fitness levels like now? Do you have any pre-existing conditions that should be looked at? So really you need to be talking to an exercise physiologist so they can look at your total situation as a whole and prescribe you with accurate amounts of exercise, looking at load, intensity and time and rest. So it's really important that you talk to your exercise physiologist and your GP and your oncologist so you can go to the right person for this sort of information. But as a golden rule, you need to be starting slowly so you can see how well your body responds to exercise. And most importantly, find something that you enjoy so that exercise can be a long-term habit, not just something that you do while you're going through your treatment. Exercise needs to be something that's done into the future. We know in some instances exercise can actually help with the recurrence of cancer. So by exercising, there may also be a component of reducing the risk factors for a future diagnosis. So find an exercise that you enjoy and you're going to be better off in so many aspects.